This is Dr. Lam from drlam.com and the Adrenal Fatigue Center. Today we're going to talk about a subject which is very, very serious, which is the role Lyme disease play in adrenal fatigue syndrome. Now, Lyme disease is a tick-borne infection that over the years has become quite a serious problem because we now know that it's not a single infectious process, but Lyme disease actually, once infected, is a continuum of many, many symptoms over a long period of time. And the clinical expression can be very, very wide and varied, and the detection is very difficult. Now, systemic infections such as Lyme, Candida, Epstein-Barr are prevalent because of multiple reasons. Now, once you have, for example, a Lyme that's diagnosed, and that first is a tremendous challenge because it is not very clear-cut. Sometimes the titers that you do depends on the laboratory values. Some labs are better than other labs. The interpretive numbers that come from the lab also can be subject to change. Sometimes you can have clinical symptoms, but the laboratory tests are kind of marginal and not very definitive. Other times you can have a definitive lab, but the symptoms may not be very, very significant. All in all, the diagnostic process for Lyme is very challenging to start. And if a doctor is not really doing this all the time, they can be overly cautious or they could miss many of such diagnoses. But let's put that aside. Let's assume that you have the Lyme and then you continue to feel tired. Now, the question is why? Now, if single Lyme infection is properly treated with antibiotics, which is normally the case, then the Lyme, in theory, would go away and then you would be back to normal health. Such is the case for some of the people, but not all the people. In fact, the vast majority of the people who have documented Lyme and treated usually feel better in the beginning, and then over time actually had either recurrences or the effectiveness of the feeling good wears off and the body continues to be attacked and then start going downhill. This is more common than you think. And once this repeats itself, then it becomes what we call chronic Lyme. And the part that is the most troublesome is that the Lyme disease itself and the tick infection, even though it may not be detected in the titer anymore after antibiotic, it continues to be in the body. It continues to release toxins. And these toxins, very small amount, may not cause any significant physiological fatigue or inability to do work. So the person, whether it's a student or an adult, can continue to work for a long period of time, not knowing that this is a problem. And oftentimes there will be triggering events such as stress, accidents, surgery that allow these toxins to either accumulate in quick time or become quite significantly damaging on a clinical basis. And that's when the body falls apart, so to say, with fatigue, anxiety, bloating, etc., and the Lyme symptoms return. Repeated courses of antibiotic usually make things worse and doesn't solve the underlying problem. And after a while, the body becomes drained. Now, the adrenal glands are part of this apparatus that is put into motion, first to defend itself and to defend the body against the Lyme toxin. But eventually, with chronic Lyme, adrenal fatigue becomes the norm. And it's very unusual to find people with chronic Lyme that don't have a lot of fatigue. While the fatigue can be due to many reasons, adrenal gland is one of the primary things you have to look at because the adrenal glands are responsible to suppress the toxins from the Lyme and reduce inflammation. And when this process is compromised, then the Lyme toxin can go what we call wild and causes a lot of systemic damage. So systemic infections such as chronic Lyme, Candida is a very serious problem. There is a good approach to deal with this, and it has to be very comprehensive, very long-term, and look at the big picture, look at how the body reacts, and the history and the constitution. Is not so simple as just putting in antibiotics, which can oftentimes make the body worse. So if you have chronic Lyme and you have a problem with fatigue, do look into adrenal fatigue. Supporting the adrenals often is a good thing to do. It has possible benefit and no possible harm if done right. And that is a take-home lesson for anybody to have who has a chronic Lyme at this particular time. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I've written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.